In a worrying development, 2 people in the United States have contracted bird flu after contact with infected dairy cows. These are the first known human cases of this particular strain of avian influenza, designated H3N2, linked to cattle. The Centers for Disease Control and Prevention reported that both individuals had close contact with infected birds on the same dairy farm. The first case, reported in April, involved a Colorado man younger than 40 who worked on a poultry farm where an outbreak had recently occurred. He experienced fatigue as his only symptom and recovered fully after receiving the influenza antiviral drug oseltamivir. The second case, identified in May, involved a man from Texas, also under 40, who was directly exposed to infected birds. Both cases highlight the potential for animal-to-human transmission of avian influenza, particularly in settings with close contact between humans and infected animals. While these cases are concerning, the CDC emphasizes that the risk to the general public remains low. However, it's crucial to remain vigilant and take necessary precautions to prevent further spread. Fortunately, both individuals who contracted H3N2 avian influenza from cows experienced only mild symptoms. The Colorado man reported only fatigue, while the details of the Texas case remain undisclosed. Both cases were promptly identified, isolated, and treated, leading to full recoveries. The mild nature of these cases is somewhat reassuring, suggesting that this particular strain of avian influenza may not pose a severe threat to human health. However, it's important to remember that influenza viruses are constantly evolving, and their severity can change over time. The CDC continues to monitor the situation closely, tracking the spread of H3N2 avian influenza in animal populations and investigating any potential human cases. Early detection and prompt treatment are crucial to minimize the impact of any infectious disease outbreak. While the recent human cases of H3N2 avian influenza are a cause for concern, the CDC maintains that the risk to the general public remains low. The agency emphasizes that these cases were isolated incidents involving direct contact with infected birds. However, the CDC acknowledges the possibility of more cases emerging, given the virus's continued circulation in poultry and now dairy cows. The agency is working closely with state and local health departments to enhance surveillance efforts and ensure rapid response to any new cases. The CDC also stresses the importance of preventive measures, particularly for those who work with poultry or live near poultry farms. These measures include wearing appropriate personal protective equipment, practicing good hygiene, and reporting any sick or dead birds to authorities. For the general public, the risk of contracting H3N2 avian influenza remains low. However, it's important to stay informed about the situation and follow basic hygiene practices to reduce the risk of any respiratory illness, including influenza. Wash your hands frequently with soap and water, especially after contact with animals. Avoid touching your eyes, nose, and mouth with unwashed hands. If you experience flu-like symptoms, stay home from work or school and consult a healthcare professional. While these recent cases are a reminder that infectious diseases can emerge from unexpected sources, they also highlight the importance of robust surveillance systems, rapid response efforts, and public health preparedness. By working together, we can mitigate the impact of infectious diseases and protect public health.